But healthcare, let's talk about healthcare. You know, Obamacare is largely an enormous omnibus bill to deal with insurance, how it's paid for, who pays for it. Not so much with how much it costs. And one of the big problems that we have in this country is that healthcare is very expensive. We pay more for healthcare than anybody else in the world. One of the reasons for that is that we pay more for medicine, the pills that we take. We pay a lot more for medicine than anybody else. And you've all probably been aware that people will get in a bus and drive across the Canadian border to buy medicine in Canada, go shopping for pills in Canada or in Mexico. Why is that? Why is medicine a lot more expensive in the United States than in Canada? The reason is that when you come up with a new medicine, you go to the government and you get a patent for it. That's something I know about. I'm a patent lawyer. The government gives you, in exchange for your new development, they give you this patent, which is a monopoly. You have a monopoly power. This is not a free market situation. You have complete control of this market. You can charge whatever you want. That's the idea behind a monopoly. And we still provide the drug companies that true monopoly market power. But our competitors in the G7 do not. The other countries in the G7 have stripped the drug companies of their monopoly power, either by strict price controls, like in Canada, they have a pricing board, and the drug companies have to go through this board and get their prices approved, or by having a single payer system or a single purchaser system. The net effect is the other countries in the G7 are paying a lot less than the drug companies need in order to make a reasonable profit. And make no mistake, developing new drugs is incredibly expensive. It takes a long time. The drug companies need a substantial profit in order for that to work out. I'm not up here saying that the drug companies don't deserve to make a big profit. That is not the point. But what's going on in America right now is we are subsidizing the cost of drugs in Germany. We're subsidizing the cost of drugs in Sweden. We're subsidizing the cost of drugs in Japan. We're paying a lot more so that they can pay a lot less. To give you an example, I take Crestor, which is a statin. It's a pill that you take every day. In the United States, that has a list price of $7.50. I think if you do the math, it's about $2,700 a year for this little pill. If you have insurance, your insurance company will get it at a slight discount, about a 10% discount. It'll be a little under $7, $6.75, $6.50, something like that. And you'll be paying, or your insurance company will be paying about $2,400 a year for this medicine. In Canada, it's $1.78. It's the same medicine. It's about $700 a year. We're paying a couple $1,000s extra for just that one medicine. Well, no wonder healthcare is a lot more expensive here. So I have proposed a change in the patent laws. And this is a game changer. This is not something that's out there in the literature. This is something that I came up with after a lot of thought, that I have proposed a change in the patent law to make it patent misuse for the drug companies to gouge Americans so that they can subsidize the cost overseas. If they're going to charge us more than 25% more than they're going to charge the other G7 countries, their patent would be at risk of being declared invalid for misuse. And when they get to 50%, it's absolute. Now, I think we can all understand that we should pay more than the undeveloped world. You know, we should pay more for drugs than folks in Africa who are living on $1 a day. But it makes no sense for us to be paying a lot more than other countries in the G7. Now, the AJC has labeled my proposal as the most innovative thing they've seen in healthcare yet. And they're going to be doing a feature story on this tomorrow. So look for that in your paper. So it's, this is an idea that I hope will get legs, and regardless of how my race goes, this idea needs to be pushed on a national stage. This needs to become the law of the land, period. This will be very impactful. You know, as people like to say, you know, it's one thing to talk about the weather, but nobody ever does anything about it. Well, healthcare is like that. I'm doing something about it. This will change the cost of medicine and healthcare in America. And with your help, we can get that done. Now, last